Hi, my name is Zara, and I was given the opportunity to talk to a midwife and have an insightful and meaningful conversation with her. The main focus of my interview was to determine what midwifery even means and why women tended to go to midwives, what their philosophy was, and what would happen if something went wrong, such as an emergency C-section, and you were at home. So she kind of let me know that the main reason people want to go to midwives is because they tend to want to have a natural, non-induced delivery. She mentioned that there's also a high population of women that tend to deal with anxiety. And especially if you're a first-time mother, say for example, you start to experience spotting and you don't have a midwife, chances are you're going to go to the ER, have to wait in line to potentially get a minor kind of answer, but you're waiting a long time. Or you connect with your GP or your OBGYN, which likely you don't have a direct line to. So you're constantly waiting to have them call you back, and you're kind of staying in this high stress kind of environment until you get your answer. Whereas if you have a midwife, you have a direct line, at least on her team you do, to connect with any of these midwives, to have your questions answered right then and there, to kind of have that instant relief for these concerned mothers. This led me to ask, what her birthing philosophy was, and it did essentially coincide with why people go to midwives. She stated that women's bodies know what they're doing, and it's her job to provide the support needed to allow it to do so. We then proceeded to discuss water births and home deliveries, which is a key component as to why women choose midwives. We discussed how studies have suggested that water births are advantageous to the mom and baby. Advantageous to the mom because it is a lot more comfortable, water is soothing, as well as minimal tearing. It's advantageous to the baby because it allows the transition from womb to world to be a lot more smooth and calm, and the baby can come out not crying and startled. She kind of jokes saying she would prefer them coming out crying so she knows that they're like healthy little babies, at least within her medical scope. We then discussed some tips and tricks to ensure the baby is in the correct position for delivery to have that natural birth, so to kind of avoid any complications of potentially having an emergency C-section. She stated that she's not able to do a C-section, but she in particular did have a specific training to do so as a surgical assist. Nonetheless, she is not able to perform that on her own, and definitely not in a home setting. So that led me to ask, what would you do in that situation? So we went over how Fraser Health has a policy that you need to have an emergency plan in place when having a home delivery and a home birth. 2 midwives have to be there. There is, the first step is calling 911. There's a resuscitation order, as well as monitoring, and any emergency equipment that would be available in the hospital is also available at the home, and she is able to act and respond accordingly. Overall, midwives are the perfect people to go to for your first delivery, and if you have a lot of questions and concerns and need that instant relief. Thanks for listening.